country's history and where we are now. And one thing that, before I ask you the question, I will say that you, the Congress, were also responsible for overseeing the economy of the United States. And it was the likes of, believe me, this was bipartisan. I'm not accusing Democrats alone, but it was over the last 8 years, the emphatic lack of oversight by the likes of people like Barney Frank, Chairman sure that there was no additional regulation on Freddie Mac and Fannie Mae, which has ultimately brought us into the economic crisis that we are in, which ultimately has been caused by the Congress of the United States. My question to you is, number one, how do we have any confidence that you, the Congress of the United States, who failed us on the economy, are now going to be entrusted with 20% of the overall economy and the health of the citizens of the United States of America? I quake when I think about that. Has us over the next 10 years, instead of a $9 trillion debt, we're going to be $2 trillion more to $11 trillion. My two questions to you are, number one, you've already told us how you expect one way or another to pay for this, which we all know how we're all going to pay for this. The same way the AMT was supposed to be for the few hundred people, and now I'm paying the AMT, and trust me, I am middle class. So, my question to you is, instead of having a new enormous bureaucracy of the public option, there have been numerous private possibilities, private options that won't cost the taxpayers anything, such as, why can't they get rid of our southern sister had questioned this, make it so that there's competition interstate between insurance. Care through the private Harvard Health, it's not the university, but Harvard Health Care. Her monthly premium, and she has excellent coverage, is $112 a month. I cannot get that here. The cheapest I can get from my employees, for a single employee, my wife went through this, is $380. So my question is, number one, there's two issues that we have here. Number one is the expense of the burgeoning expense of the healthcare system, which can be addressed through the private sector without any of your government help. Thank you. That's number one. Number two, something like in the automobile industry, you have an assigned risk pool for people who can't get insurance. Why can't we have a quote-unquote, some sort of assigned risk pool for the approximately 15 to 20 million people who truly don't have health care, who truly need it, and that way it can be divvied up among the insurance companies without any of your help.
Thank you for a couple of very good questions there. First of all, just my opinion, but if the private market and the private insurance companies were going to fix this problem, I think they would have done it already.
They've been allowed to.
What if they can't compete?
I don't know if how many people here are happy with 15, 20, 25% yearly increases, or 39% just now. But that's not the sign of an insurance industry that is going to regulate itself. I'm happy for your daughter. I wish that I had that low a premium myself, but I don't. But nonetheless, the exchange that's created under HR 3200 is a national exchange. It's a national marketplace wherein citizens and small businesses can go in and buy coverage from any of the health insurers that are currently on the private market. It is not a takeover of the health insurance industry. It's not a takeover. It is certainly not a takeover of the healthcare delivery system. We are not proposing.
Please, ladies and gentlemen,
We are not proposing to buy hospitals. We are not proposing to tell doctors what treatments they can give to a particular patient. We want to give you more choice and better prices. Okay, so that's what I'm looking for.